overall at Windsor Regional Hospital, we have about 20% of our beds that are private. So that's had a particular, or given us a particular challenge during COVID-19 in that when we have a rule out case that comes in while we're waiting for their specimens to come back, their results to come back, we have to have them alone in a room. So if we don't have enough private rooms, they have to be put into a semi-private room and we have to block a bed. And sometimes they have to be put into a ward room, so we might be blocking 2 or 3 beds in that room. So that can very quickly reduce our capacity. Right now we're on the clinical teaching unit at the Ouellette site, which is a 30-bed unit. On any given day, we can have anywhere between 5 and 10 beds on that unit that are not usable because we are having to segregate or isolate, rule out COVID-19 patients. So what we've started to see since late summer is our volumes have been increasing of non-COVID related diagnoses. So for the first few months of the pandemic, we found our presentations to hospital actually decreased significantly as people chose not to come to the hospital. They might have been fearful of catching COVID at the hospital and had started to see some late presentations, latent disease. So we're getting people now that are very, very sick that are coming into the hospital. They're having prolonged lengths of stays. It can be challenging to get them back out into the community with adequate community support and or transitioning them to other facilities such as long-term care, rest and retirement homes. So what we're trying to do, we have opened up additional beds, so on our 2nd floor at the Ouellette site and on our 7th floor at the Met site, so that we've expanded our capacity. In addition to that, in the extra medical patients that we're getting, we are trying to increase our surgical capacity because there is a huge surgical backlog across the province. So all of us are trying to get caught up in all of those surgical cases that were canceled or delayed due to the first stages of the pandemic when we shut down all the elective surgeries. One of the rooms on the CTU that we've actually converted into a patient space. So prior to that, you can see it was a multidisciplinary room. So if we go inside, you can see that we're storing items in here. And also you can see the hoarding that's up there. And what that's doing is it's split the room into 2. So we have storage on this side, and on the other side of that hoarding is a patient. CTU used to be a pediatric unit actually. So some of the rooms that are on this unit might have had 1 crib in them, and now they've got 2 adult beds. Some of them that were 2 cribs are 3 adult beds. So it's very, very tight. And this is an older building, so I think we're about 100 plus years old. Similarly at the Met site, it's an old infrastructure. So the rooms were really not built for the amount of equipment that we're using with today's technology. We're supposed to maintain a 2-meter distance between cases. Obviously patients are not going to be wearing masks when they're in their room. And you can see here there would be another bed here in this room, and I would actually be able to touch 2 beds. So there's no way we can maintain 2-meter distance, which is another reason that this bed has been removed from the room to make a private, but in actuality it's decreasing our census and our capacity by a bed. So this happens throughout the hospital so that we can maintain safety of the patients while we're clearing patients of COVID-19. Reduces the access to visitors and emotional support for our patients. So while somebody is a rule-out case, we can't allow visitors to come in. Because we are trying to maintain safety of our community as well as safety of our staff and our patients in the hospital. So we're trying to reduce traffic until we can make sure that that patient is negative before we can then implement any visitation at all. So that really hits hard for our patients. It's also very stressful for our staff as they're kind of the alternate that's there to support the patients and provide that emotional support. So that contributes a lot of stress too to our healthcare team.